Hey, hello everyone. Thank you. First of all, I would like to thank GeekyAnts for organizing this event and inviting me. I'm so happy and so happy to see some very young faces. Very excited to know about AI in healthcare. So, just a very brief intro about myself. I'm Rejesh Bose. So, I work as a director of programs and partnership at a company called Qure.ai. So, Qure.ai is an Indian healthcare AI startup. We work predominantly in AI in radiology. In the beginning, the team Priyamvada was mentioning about this how the cancer screening was done with the help of AI. So we are one among the organization who work in cancer screening, along with other anomalies in the healthcare and AI. So just going ahead, we'll deep dive into the other aspects of it. So it's like it's just talking about AI is something. It's always conceived very differently, right? I mean, you go and tell to anyone you work in AI, people see that what comes to their mind is sometimes a robot doing surgery or something like that. So it's always AI is something. I mean, still it's a concept. It is not something not very solid like a car. You say car, everyone understand what's a car. So AI hasn't reached to that level. It's still a concept for everyone. And whenever you say you work in AI, the way healthcare, the bureaucrats, the government, everyone conceives it very differently. But virtue of human intelligence, we had philosophers who thought about AI in 1950s itself. We had one of the definitions coined by John McCarthy about AI that saying it's a science and engineering of making intelligent machines. Yes, we are in 2023. I think we are going towards making those machines, those technologies, which makes human life easier, which is making more impact in the human life. So this is like something since I'm sure that I am not a tech geek, but still I mean just want to start with what like giving the like all the AI models are worked out on machine learning and deep learning we also use. So Qure.ai, we work very actively in very active R&D team, and we have developed our products after very deep learning and algorithms we have used, and we have more products in the market currently. So just going ahead. So just to connect why AI is needed in healthcare, this is something that like why healthcare. I mean, unlike like every other domain, healthcare is also something that where there's a huge demand of AI. One reason it is operationally huge. You take any hospital, any government medical college or any private hospital, the kind of operations happens in a hospital premise is huge. It starts from giving a nurse, ordering a drug. It's like taking an X-ray, managing the OPD, so managing the consultations, making the fee, the supply chain. So the operationally, it's a very huge premise where there is a lot of things to be, a lot of activities, lot of aspects needs to be automated. So AI has a big role. AI has a lot of scope, not much more than what currently is there in the market, but there's a lot of scope. And as I said, there's a lot of it also involves huge amount of data, and the data which healthcare deals is it's more sensitive, more more uh, patient confidential data. So that is also one thing which makes healthcare little riskier, as well as there's a demand to it. So that is also one reason our need of AI, why there is a huge need in healthcare. Then definitely, as you know, it's all burnt out workforce. So what AI is trying to make is the life easier, the lives easier by making an impact in healthcare operations and the healthcare delivery. So that for that companies like Cure and a lot of companies are taking a front head in that. And it's also something that universally scalable. So if you have a technology, if I can match the regulatory metrics to the countries, and the healthcare is universal, we can scale it across the globe. That is also something that makes healthcare an area to dive with AI. So there are existing solutions, as you all know, and some of them are like there are very core solutions in diagnostics. So diagnostics, whether it is in pathology, whether it is in radiology, there are many AI organizations currently working across the globe, which includes in India. In Indian companies are there. There are in ECG, EEG, X-rays, digital pathology, biomarkers. It goes on. So medical research, remote monitoring, personalized medicine. Personalized medicine, it comes where every the genetic aspect of it, every patient data, everything is measured, and the health and wellness aspect is given back to the patient, like Healthify Me does, or like multiple products has that angle of personalizing healthcare is also a byproduct of AI. So yeah, AI is also like as I said, like as Priyambada was mentioning in the beginning, this large language models, just like Chat GPT, we are trying to build things in AI, but in healthcare. But due to the confidentiality, due to the due to the nature of healthcare, it's not something like not all the informations can be applied on ourselves. There's a lot of lot of concerns around that, a lot of regulations around that. So, but still, it is a model which is being worked across the globe, and we are expecting a lot many large language models coming through AI in the healthcare domain. And digital pathology biomarkers is something that we have in place, but yeah, looking forward to more products, because cancer screening and identifying these biomarkers actually makes an impact in quality of patient life, and also in the time, that's healthcare time is something that matters a lot. If a cancer or something is screened today or screening after 5 years, makes a lot of difference in many people's life, and also financially, as well as it is making a difference to the patient, to the hospital, to the community, to the globe, everyone. And yeah, as I mentioned, hospital operations, like we always talk about AI on a patient angle, but there is a lot of scope to do with the hospital operations AI, which most of the hospitals, you take Apollo, Fortis, all of them are friend diving those their own product. They are partnering with different organizations. But hospital operations is something, like, since there's a room full of scientists, I'm just telling there's a lot of scope for the AI products in there, especially in supply chain operations, even in the HR. Hospital is one place where there's many human resources are being managed in a single day, which start from housekeeping, nursing, to the doctors, everyone. So there's a lot of scope for that as well. Then insurance, yeah, it handles a huge amount of data, and there's a lot of delay in insurance claiming, whereas also where large language models and the AI models can add value in the healthcare aspect. So so these are, some of the AI health use cases which AI can do in healthcare, which you all know, but just want to highlight few of them, which is helping with reading X-ray CTs, to developing vaccine, processing huge data from health records. Health records is something most of the hospitals has actually digital data, but just digital data is not actually utilized to the full potential, though it has its own confidentiality and regulatory aspects. But if there are models which can make benefit to the patient and to the hospital with this data, that is something can be thoughtful, and there are organizations currently working in it. And this triaging of patients live with the help of chatbots, and early diagnosis of disease, all these things, I mean, we have a lot of scope for the AI. And yeah, just repeating, I mean, the personalizing the treatment, hospital operations, going at potential target for drug sensitivity tests, epidemics, lot of things. I mean, if you like, healthcare is something that's very vast, where there are lot of scope for AI to do in healthcare. So just like going into what we do as an organization, what is Qure.ai doing, and how are we impacting AI community. I'll just go through it for a very briefly. So we work in predominantly in the domain of radiology, and AI in radiology, to be very precisely. And the mission which we are right now is there in making healthcare more affordable and accessible using the deep learning. And we have like the regulatory aspect of healthcare is something that we seriously take, and we have all the needed clearances, FDA for United States and the CE for Europe, and Indian clearances, and every country has its own regulatory landscapes. And we have done that, and we are right now, we are impacting around more than 5 million lives on yearly. And we are also recommended by World Health Organizations for screening of tuberculosis in certain settings. And we have a team of 200 plus people, and this is our global footprint. We had a great impact. We have deployed across the globe with around 80 plus countries we go. And I'll just go a little faster this slides, because it's so we have a very interesting product portfolio, but still the focus is more given to the X-rays and CTs. So we have product where we can you give a chest X-ray, take a chest X-ray. Our AI built product can read these chest X-rays and also detect diseases including lung cancer, lung nodules, lung malignancies, opacities, consolidations, tuberculosis. It goes on, around 30 findings we can find from a chest X-ray. So same with, we also the critical neuro cases can be screened with the help of AI. Though think of a situation where there's a doctor is not available. So where AI gives the AI triggers, AI triages, AI notifies the doctor, so that the without the doctor being physically there, so the treatment goes on. The patient is getting benefited. So things are moved to the next step. So that is what we work in head CTs. So, and also we have a product to spot fractures from the musculoskeletal X-rays. and we are also having lung cancer screening from chest CTs. So right now, as a company, we are currently focusing on the radiology aspect of it, and we have AI product which is currently working in radiology with all these use cases which I mentioned. So I'll just quickly walk through few use cases which our product does, and also connect it to the AI in healthcare landscape. So we have same product which works in different use cases. So why it is important is to take so suppose from chest X-ray we can read tuberculosis and lung cancer. But tuberculosis is a disease, like you go to United States, UK, the prevalence is very less. So when a product needs to be globally scalable, it has to have understand the geographical aspect. So something that make more sense would be in a different settings or different geography would not be tuberculosis. It would be lung cancer. So it's very prevalent in the US market and the Western market. So more than tuberculosis. So in that market, that's where our product use case fits. So when it goes to tuberculosis prevalent countries, including India, Latin America, or some places in Africa, and the focus would be the use case would change. So that is something AI can always think through. That is somewhere where like any product we make, we have to have universally, we have to do the you know uh, the customizations and the kind of something that the product itself has should have the capability to scale across the geographies. So that is something that we need to be mindful. I mean, this is just telling about our product. We have around 6 use cases where we can one of our product can screen tuberculosis, lung cancer, heart failure. It can be in ICU settings, it can be used emergency rooms, it goes on. So I was just taken an example. So this also brings to the situation that like how AI model is built. As we all know, the data is the data is the background or the foundation for AI. So when you want to scale it up, we also want to make sure that the data contains a geographic aspect of it. We cannot make a model with only having data from India or somewhere in Bangalore, and we cannot scale it. So that is also somewhere the importance of data, importance of universal data becomes important, because then only the product will make sense to the geography and the community it has to serve back, it has to serve. So just putting, I mean, like health system, I mean, is as a whole, like the whole as a whole health system, how AI is impacting in from my experience is mainly on clinical aspect. As we all know, it's the patient is getting benefited. The patient a disease is screened or identified or diagnosed at a couple of days earlier means always his quality of life increases, the chance of curing increases, the chance of better life, everything gets increased. So there is a direct patient outcome with the AI, and the direct clinical outcome, and also the hospital aspect of it. There are chances for misinterpretation or misdoubt readings. So that is something that always AI does that double check. So something when we go and talk to the doctor community or the medical community, we make sure is we always take the stand. AI is not there to replace the doctors, or not to act as something not to replace or not to compete with them. It is instead, it is AI currently, and every time I think AI has to complement the existing health system and make the result more more impactful. That's what we do, and that is what in every aspect we are trying to do. Even if you look at the economics angle of it, so there is a long term benefit to the state, to the country. Suppose an AI product is saying that today we are screening tuberculosis, and out of 1,000 x-rays we did, 70% of them are not tuberculosis. So that means the state, usually it's a government, has to do the true net CB net test, which is usually expensive for the for the beneficiaries. So when AI model is saying with high precision that this is not needed, so in turn it is actually saving the cost from a health system. So that is the economic angle of it. So every product, even if it is a minor thing, like even if it's aspecting all the regulatory aspect and doing the right validation, it can make a big impact, and that impact is actually universal. So now, like I had an experience in implementing AI in Indian health system. So it's not always as a cakewalk. This is something that I want to again highlight. We think of implementing AI and going ahead with our products, but when you go and talk to the communities, so there's lot of confusions and concerns around the data confidentiality. So everyone, I mean, everyone thinks that you are there to data when the product. So that is something that misconceptions, that something need to be clarified, because healthcare data is, end of the day, that data is entitled to the patient. or to the respective person. So we or no one can take it and make a model out of it. So there are ethical ways to it. We have to procure from the ethical sources and do the thing. So when you go and deploy any AI product, any AI company, this is some challenge which they are facing, especially in large scale involvement. The concerns about the data needs to be, it may be, you may have all the regulatory confirmations, regulatory aspects, but still people may not be understanding it in that sense. So those sort of communication, those sort of conviction to understand, that is something that's a reality check which I had during my AI implementation experience in 2021 and 22 I faced. And the regulatory landscape is also very tough. If you go to any country, I mean, if you take Thailand, Vietnam, every country has its own local regulatory aspects, and you take the FDA aspect of it. So in US market, which is the biggest market, without FDA nothing can be ran, and these are very tricky, long term, and very exhausting process. So that is also something, when we think of AI implementation, building AI products, something we need to be mindful. And FDA is like, though it's an US thing, I mean, wherever you go, if the product is FDA approved only, you will get that the sense of accepting it. So there's a lot of such concerns which we need to be mindful and which we need to work towards it. Then another thing is hardware and infrastructure. Not everywhere. I mean, even if there should be a minimum internet or uh, minimum infrastructure we required to run a machine. Not in low and middle income countries or countries like India. Like, let's think about beyond Bangalore or beyond metro cities. Not everywhere we have the enough infrastructure to run it continuously. That is also some challenges we are facing. So that makes you scientists, make the tech community to build more products, more hardware agnostic, and which can run in very less infrastructure, less tech infrastructure. That's also some angle to think through, some thought for the day. And the business angle of AI scaling up is, it's not having the universal use case is very important. The use case should be like, whatever it is we are doing in the healthcare, it should be it should be something making sense to the whole healthcare community, and nothing can go on its own. It needs strategic partnership. That's where which it is needed. So maybe, I mean, any company, we may need to work with pharma companies, medical devices, going ahead, educational institutions, researchers. So those sort of partnerships can only build or make a product its own, having its own address. So those strategic partnerships will something impact and something that going to influence the growth of these organizations. And as I said, there's a relevant use cases. Though the product can do wonders, but we need to understand which use case works in which geography better. That is also something to be mindful. And healthcare is very, very empirical, very evidence oriented, domain. So, like, though you say your product can claim screen lung cancer or screen heart failure, but that is not enough for the healthcare community or to be get the acceptance. So we need to have the enough academia, enough researchers, enough working to come, enough ground truth validation should come from the actual real time deployments, and real time learning should come. So yeah, and just to, like, and something also very behavioral thing is, there is a regular workflow, regular aspect. There is everything is going on already there. So when you go and impact, say that AI can add value, this value is not known to someone already. So you have to do it without disrupting the existing operations or existing workflow. That is also something that no one wants to do, even to, like, not even a data entry, and no extra job is not anyone is appreciating. So that is also an angle that we need to look. The product which we are developing and sending out the market should not have a stage of adding extra work to the user. So that's the very thin line. Without disrupting the existing operations and workflow, this product needs to get embedded in their actual ecosystem. So the way forward thinking, I mean, there is a scope to massive scaling up. The technology is booming. Companies are there. There's a lot of VCs, a lot of funding, a lot of AI is, as you said. I mean, I think 2022 must be an year for AI. Post COVID, we have heard about a lot of companies within India and across the globe has come up, and, like, whatever the proven solutions, radiology is one of the proven solution in AI healthcare. Strengthening, those proven solution is something that the policy level decision we need to come from the governments, from the bureaucrats, which needs to come from. And there is, like, a lot of regulations. Still, AI cannot sign a report or cannot do anything. I mean, because on its own, it's still structured or still linked to the the conventional angle of it. So those regulations, how those can be eased out, how those can be made more more beneficial to the AI community or the tech community, that is also something to be thoughtful and to be to be combined, needs to have those efforts happening at the ministry level or the policy level, needs to have happens. And also more like just like GeekyAnts is doing, having that research collaborate mindset. So that sort of support and making people calling in one room and talking each other and learning and unlearning from each other. So that sort of support is also going to add value, I believe. So just running a little fast due to the slides. Just want to do justice to the time. So yeah, just to conclude, so there is a lot of scope. AI can assist to deliver better clinical care. AI can become mainstream in clinical care delivery soon, and it also definitely increase care coordination. The way which we communicate has changed over the years. So now coming in with AI, the healthcare communication is going to again multifold impact has to is going to come with the addition of AI into it. And also patient outcomes. So end of the day, healthcare revolves around the patient. I mean, the ultimate beneficiary is the patient who walks into a hospital. So that patient outcomes is also something that AI is going to add value. The moment patients start receiving those direct benefits, then like it will not be a community, or it will not be something driven by the tech companies. It will, this request or this demand or this interest will come from the public itself. Yeah, so just to add, the idea of AI is to make lives of patient or the users or the doctors or the hospital in the healthcare setting to make it comfortable, fast, and precise. So that AI have the capability, and we are into that directions. And with that, I'm just posing here. I couldn't walk through all the slides, so like very the tech side of it, my fellow speakers will be deep diving into it in the later sessions. But with this, I'm ending my session. I know I went a little faster, but just wanted to have as many as thing. And I'll be here if anyone wants to connect or to know more about what we do, or just for anything on anything that I'm happy to help, happy to network. Yeah, thank you.